Good morning, Bruce.
Good morning.
My name is Justin Danhoff. I'm General Counsel with the National Center for Public Policy Research. My question is broadly about the future of the healthcare market generally. In recent years, Humana, you guys have had unique opportunities to play a major role in fixing the failing mechanisms of the Affordable Care Act. However, we've confronted you guys on certain issues, and you've chosen to punt many times. For example, when we specifically confronted you guys about the peril of taking taxpayer bailouts through Obamacare's risk corridors, the company chose to defend the bailouts and even lobbied the Obama administration to increase those bailouts. That risk was real, and now those bailouts are part of protracted litigation. The company made kind of a bad deal there. Furthermore, when there was a lawsuit that sought to unravel some of Obamacare's market-distorting provisions, the company resisted and joined an amicus brief that argued to uphold the law in the Supreme Court case of King versus Burwell. Many of the conservative complaints about Obamacare have since come to pass. We all know if you liked your doctor, you couldn't keep your doctor. If you liked your health care plan, you couldn't keep your health care plan. And now with Humana and so many others dropping out of the Obamacare exchanges, those are truly in a death spiral. One of your fellow CEOs made that statement just a month and a half ago, I believe. So Humana shares a responsibility that many millions of Americans are suffering under Obamacare. You share a responsibility for that. Therefore, I think it's incumbent upon the company to be part of the solution. The current political climate offers a unique opportunity for both private industry and healthcare consumers. President Trump, as we know, has vowed to repeal and replace Obamacare with a more patient-centric approach and to provide greater options using market forces to help control prices. The first attempt at this effort, as we all know, stalled in the U.S. House of Representatives. But I think the American people still deserve a solution to many of Obamacare's broken promises. So my quick question is, will Humana seek a seat at the table by working with the Trump administration, as it did with the Obama administration, to promote this new health care agenda? And what specific reforms would you suggest to President Trump that he should focus on?
Sure. Let me explain, and I think it's an important question about our role in healthcare and where we, as an organization, are focused. And as you well know, we've worked on both sides of the aisle, both on the Democratic and Republican side, and including meeting with President Trump and President Obama. We view, and we've learned a lot over the last few years about ourselves. And I think the most important thing we've learned is where we can be most valuable to society. And we feel that our value in society today is to focus on senior chronic conditions. And for us as an organization, the exiting of the exchanges is more about where we believe we can add more value than the political environment as a whole. And so our engagement with the administration and with Congress is really around how can we advance taking care of seniors. And our engagement is not around non-Medicare Advantage or non-Medicare businesses, because we find that that's really not where we best can serve the society as a whole. Thank you.